Good afternoon, everyone. Welcome to the fourth Living with Dementia webinar series. My name is Cindy, and I will be your MC today. Thank you for taking the time to join us online. Today's event is organized by the Boon Khim Mind Science Center with support from Emeritus Professor Hong Hai and Wen Hai Clinic, as well as other donors who supported Mind Science Center's mission to improve mental health and resilience across all ages. In this webinar series, we will be bringing you distinguished panelists from various fields with the aim to establish a platform for Asia-centric knowledge about dementia prevention and management. Today's webinar is our fourth edition, and we are honored to have Assistant Professor Junhong from NTU. Without further ado, I would like to invite Mind Science Center's Education Director and Psychiatrist at Mindcare Clinic, Dr. Rathi Mahendran, to give the opening address. Dr. Rathi, please.
Yes. Thank you. Thank you, Cindy, and good afternoon, everyone. I hear that we have close to 400 registrants, and we're happy to have all of you attend this very important webinar on mindfulness and cognition. It's my pleasure really to introduce Dr. Yu, who has worked with us in the past before he moved on to his new position. Dr. Yu is an assistant professor of psychology at the School of Social Sciences in the Nanyang Technological University, where he is the principal investigator of the Cognitive and Brain Health Laboratory. He was the recipient of the 2021 Nanyang Assistant Professorship, a prestigious early career award that is awarded to exceptional scholars from Singapore and internationally. Prof. Yu, he did his undergraduate studies at NUS and then obtained his PhD in psychology from the University of Hong Kong, where he did his doctoral training in clinical neuropsychology and multimodal neuroimaging. Prior to this, he worked, prior to his current appointment in NTU, he was a research fellow at the Department of Psychological Medicine, Yong Loo School of Medicine, National University of Singapore, and was actively involved in several community mental health and cognitive aging research projects. He has won several awards. Most notably, he won twice the first prize for Psychology Research Publication Award and also an Outstanding Talk Award at the Society of Neuroscience. Right now, apart from his research work, he also does extensive teaching at NTU. And not only that, he provides academic mentorship, working with the Curriculum Development Committee, and he also coordinates the Aging, Inclusion, and Health Research Cluster. And he has also served on the panels of Foundation Botna, a Swiss NGO, and in Medical Research Future Fund for the Australian government. So without further ado, let's invite Prof. Yu to deliver his talk on MRI brain imaging studies.
Okay, thank you, Prof. Rathi, for the introduction. Okay, a very good afternoon to all attendees, guests, and distinguished panelists. So my name is Junhong. I'm from NTU. Today I'll be talking about mindfulness and cognition, right? And what does neuroscience tells us about mindfulness and cognition? So let me first start out by saying that mindfulness is becoming increasingly popular over the years. So as you can see over here, this graph shows you the number of searches on Google using the keyword mindfulness, both in Singapore and worldwide. So you can see that the number of Google searches on using the mindfulness keyword has almost doubled in the past 10 years. Right, so there are 2 times as many people who are now interested in mindfulness. There are a lot more people who are searching for information regarding mindfulness. Okay, and as quite naturally and quite expectedly, you would see that this in this graph, right, the peak occurs sometime during the COVID period. I guess that's where people they are actively looking for ways to cope with the isolation and distress during the COVID-19 period. And perhaps, mindfulness will be one of the more common, more popular ways to deal with this distress. Okay. Yeah. So as you can see, in terms of the interest level has doubled across the past 10 years, both in Singapore and worldwide. Okay, and as such, right, there is currently a lot of information about mindfulness online. There's a lot of YouTube videos on guided meditation, guided mindfulness meditation, right? There's a lot of information out there. Unfortunately, not all of these information are accurate. Some are not factual, some are not so reliable. So I think it is right now it will be a very meaningful time to talk about the science of mindfulness, right? To go through the facts, to go through the neuroscience of mindfulness, and and that's why I'm doing this talk here. Okay, so let's first discuss the psychology. Let's first describe briefly the psychology of mindfulness, right? So I think there are many different schools of thoughts on the topic of mindfulness, but in general, mindfulness can be generally defined as attending to the present moment in a non-judgmental manner. Okay, so what do I mean by in the present moment, right? So throughout the day, our mind is most often, wandering around. We are often thinking about the past, right? We are often perhaps having some regrets about the past, thinking about how we can do things better in the past, or sometimes we worry about the future, right? Or sometimes, you're just thinking about, what you want to eat later for lunch. So our mind is often often oscillating between this future and past, wandering around. But our mind is seldom at the present. Okay, so that's where mindfulness come into play. One of the key tenets of mindfulness is to redirect our mind, redirect our attention back to the present, right? Because throughout the day, our mind is often wandering in the future, into the past, right? So now we want to redirect our mind back to the present. Okay, the other keyword here is in a non-judgmental manner, right? So if you're attending to the present moment, there's a lot of things to take in. Like right now, behind me, there's a heavy downpour. Behind me, it's raining very heavily. There's a lot of things going around me right now. Okay, so if you try to attend to the present moment, your mind will be full. Okay, so the trick here in mindfulness meditation or mindfulness in general is to simply let go of these judgments, right? Attend to the present moment, and whatever thoughts that come to mind, just simply let go of the judgments. Just passively, watch it go by. Just drop the judgment, right? Only by dropping these judgments, only by embracing all these thoughts in a non-judgmental manner, can your mind be mindful. Okay, so usually in mindfulness meditation sessions, what we are usually instructed to do is to pay attention to our bodily sensations and sensory experience. For instance, one very common practice is to pay attention to our breathing, the pace of our breathing, right? The sensations of breathing, try to feel how the air goes through our throat, goes through our diaphragm, right? Try to appreciate all these feelings, sensations in a non-judgmental manner, right? So by focusing our attention to these present sensations, these sensations in the present moment, we are essentially redirecting our attention back to the present moment. On top of that, we need to be constantly aware if we are drifting away, right? So, during a mindfulness session, sometimes our mind will wander into the future, right? And that's where we need to tell ourselves, hey, let's get back to the present, right? Or if we are thinking about the past, what happened in the past, then we need to tell ourselves, let's get back to the present, right? We need to constantly redirect our attention back to the present moment. So as you can see over here, right, mindfulness meditation, it is something that requires effortful control of our mental processes. It requires effortful control of our thoughts, right? I think most people who are just starting out, who are trying this out for the first time, they might not be able to do this successfully. It requires quite a bit of practice in order to master this mindfulness meditation practice, okay? So mindfulness meditation is not simply a session to rest and relax our mind. It requires a lot of work, right? It requires a lot of effortful control on our part. Okay. Yes, after the mindfulness session, you might feel quite rejuvenated. You might feel quite well rested. But during the process, it's quite yeah, it can be quite intense. Okay. So essentially, we can think of this mindfulness meditation as a type of mind-brain exercise. Okay, so let's discuss further about this concept of exercise, right? So in the physical health context, right, the more you exercise, the healthier you become. I'm thinking this is very simple. Everyone understands this. Okay, so if you are like regularly doing weightlifting exercise, to train up your strength, train up your muscles, your muscles mass will increase, right? Your muscle size will increase, right? So similarly, in the brain health context, the more you exercise your brain, the healthier your brain will become. Okay, so if you were to think of mindfulness as a brain exercise, right? This mindfulness meditation, it thickens your brain in the same way that weightlifting exercise builds up your muscles, right? And also mindfulness also helps to enhance various mental functions, as I'll explain later. So why does our brain respond in this manner? Why is it that our brain can expand, can sometimes even contract, right? That's because our brain is a very plastic organ. So there's this concept in biological psychology or in neuroscience called the brain plasticity or neuroplasticity. Okay, concept, right? So what it says is that our brain is very easily molded by experience and practice. Right, you can think of our brain as like a plasticine like that reacts or responds to our environmental trigger and our experience. Okay, so if we consistently perform a task, consistently perform an activity that triggers, that activates a certain part of the brain, over time you'll see that this part will become bigger, right? And over time you see that this part will increase its wiring with other parts of the brain. Okay. So the keyword here is that there has to be consistent exercise and practice. So if you're just doing this for just one time or just a few times, it's unlikely that you'll see any benefit to your brain, right? You need to do this consistently, just like if you go for a jog, you have to jog consistently once every week or a few times every week in order to enjoy the benefit, in order to enjoy the health benefits of jogging. Okay, moving on to the next part of my talk. So I'll talk about I'll explain to you which mental functions are enhanced by mindfulness practice. So to describe to you which mental health practices are enhanced by mindfulness practice, right? So let me go over with you the results of an intervention study that was conducted by the Mind Science Center at NUS a couple of years ago. So in this study, we recruited participants aged 60 to 95. Okay, so these people, they are diagnosed with mild cognitive impairment. So what is mild cognitive impairment? Mild cognitive impairment is simply an intermediate stage of cognitive impairment. As you can see over here, it's an intermediate stage that lies in between the healthy stage and the dementia stage, right? So everyone who has reached this dementia stage would have probably gone through this mild cognitive impairment stage previously. Okay, so this mild cognitive impairment stage is a stage, it's a diagnosis or it's a phase where we can possibly do something to stop the cognitive decline, right? To stop the memory decline or to delay it, or at the very least delay the decline in mental health, mental functions. Okay. So in this study, we recruited about 54 participants, 54 senior citizens. So these participants, they are randomly assigned to the mindfulness group, 27, and to the control group. So it's equally split into both groups, right? So then we administered our first time point of measurements, right? These measurements are carried out at baseline, right? So what did we measure? We measure working memory, right? How do we measure working memory? So this is a very simple task, right? For instance, I'll give you a series of numbers, 892, 378. Okay, then I'll require you to recall out the numbers out aloud, right? Or in another instance, I'll give you another series of number 39216, and then I'll ask you to recall out the numbers in the reverse order. Okay, so both of these tests, they require you to make use of your working memory. It requires you to store these numbers in your working memory and manipulate these numbers. And we also measured their long-term memory using a simple word list task, where we will give the subjects 15 words to learn, right? And subsequently, 30 minutes later, we'll ask the participant, can you recall out the 15 minutes, the 15 words that you have learned about 30 minutes ago, right? So this is measuring the long-term memory. We also measured the divided attention using this somewhat interesting task. So over here, you can see that there are some numbers enclosed in different colored circles. So what the subject has to do is to basically connect the circles in a numerical order from 1 to 8. However, there's a catch here, right? Each time they move up to the next number, they have to switch to a different color. So for instance, you start off with pink, then you have to move on to yellow, then move back to pink and yellow and so on. Okay, so this is a measure of divided attention because the subject has to divide his attention on the numbers and also on the colors of the circle, right? So this is a measure of divided attention, right? And then we measure how fast the subject will take to complete this task. And then we have a very simple test of visual spatial ability where we have this blocks here. We have some blocks over here, and we will ask the participant to try to arrange the blocks in a way such to replicate this pattern over here. So it's kind of like a jigsaw puzzle. And in the final test, final test of mental ability, we ask the participants to we give the participant 1 minute of time, and within this 1 minute time, he will say out as many words, as many names of animals as possible. So usually they will be able to say around like 15 words on average, 15 animals, say out the names of 15 animals on average. Okay, so this is a measure of semantic fluency. So after the baseline measurements, right, these subjects, they are then, they proceed on with their intervention programs. So for those who are assigned to a mindfulness group, they attended 9 months of mindfulness practice. For those in the control group, they attended 9 months of health education talks. So take note over here, right, this 9 months is actually divided into two phases. So in the first phase, right, the first phase consists of 3 months where the mindfulness sessions and health education talks, they are carried out once per week. Subsequently, in the next 6 months, these sessions are carried out once per month. Okay. So what did participants do in the mindfulness sessions? So they have so they carry out quite a number of mindfulness related activities. They carry out quite a number of mindfulness related activities. So for instance, we have this activity called the mindfulness of the senses practice, where they have to attend to different senses, right? They have to pay attention to what they are seeing at the present moment. They have to pay attention to the environmental noise, right? They have to pay attention to what their skin is touching at the moment. All right. And they also engage in a body scan practice while sitting or lying down. This is to develop kinesthesia. Okay, this is simply the awareness of the moment and position of the body parts. Right. So once again, this is attending to the present moment, but in a different way. So over here, you're attending to the movement. You're paying attention to the movement and position of your body parts. So there is also a walking meditation practice, right, to cultivate calmness and momentary concentration by walking slowly with mindfulness. And we also have a visual motor limb task, which is a couple of visual motor limb tasks to train one's mind-body coordination. Okay, so as you can see, mindfulness is not just simply about sitting down or meditating. You can have certain mindfulness tasks that involve some physical activity, like basically walking around, or stretching your limbs, and so on. So after 9 months later, right, we measured the same set of cognitive functions, the same set of mental functions again. So this will be a measurement too. Okay. So, and how do we analyze that? How do we analyze the results? We simply compare the results between across the time, right? Across these 9 months, you see if there are any improvements from measurement 1 to measurement 2, right? And you also compare between these two groups. So what we found was that over the 9-month duration, right, the mindfulness group has significantly improved scores on working memory, which is the numbers, which is the task where I ask you to recall a series of numbers, and divided attention, where they are asked to connect the numbers from 1 to 8 or 1 to 20 in the actual task. Okay. So in conclusion, from this study, right, we show that mindfulness as a brain or mind exercise can actually improve your ability to process information and multitask, right? Because we need working memory, we need a working memory to process information, we need divided attention to be able to multitask efficiently, okay? More importantly, we showed that, all these improvements occurred among people with mild cognitive impairment. What this means is that even among people, even among senior citizens who have already experienced some kind or some degree of brain degeneration, right? They do benefit from this mindfulness training, right? They do see some benefit from this mindfulness training, right? Right. Okay, so that was just the findings from one study with only 54 participants. So I'm sure, some of you might not find this convincing because this is only just one study, only 54 participants, right? Okay, so let's expand the scale of this research, right? So what if we pull together the results of all previously published randomized control trials from all previously published mindfulness meditation interventions? Okay, so to describe next, I'll describe the findings of a meta-analytical study that was carried out by a colleague of mine in NUS psychology. Okay, this was done. This research was analyzed and led by Dr. Nanyang from NUS psychology. So what she did was that she pulled together 119 mindfulness intervention studies. So altogether, these 119 mindfulness intervention studies consisted of 9,538 participants, right? Close to 10K participants, okay? Overall, what she found that across all these studies, right, results suggest that mindfulness meditation significantly improve attention, working memory, multitasking. So very similar to what we found in our NUS Mind Science Center study. On top of that, she found that participants who went through the mindfulness meditation, they have significantly improved inhibition abilities. So what do I mean by inhibition? So let's take a look at this simple test of inhibition. This is called a Stroop test. So over here, you can see that there are a number of words printed in different colors. So purple, yellow, red, black, red, green. So if I were to ask you to simply read out the words as they are, it will be a very simple task, right? Just purple, yellow, red, black, red, green, okay? But you notice that these words, they are printed in different colors, right? So instead of reading out the words, I want you to read out the colors, right? So this will be red, blue, green, yellow, green, black, right? So if you read out the colors instead of the actual words, you see that this is a lot more difficult, right? So go ahead, you can try it out yourself. You see that it's a lot more difficult to read out the colors than the actual word, right? And why is it difficult? Because essentially you have to inhibit the meaning of the word when you try to say out the colors, right? Because over here you can see that the meaning of the word is different from the color that the word is printed in. So you need to inhibit one part of this word, inhibit a certain aspects, certain aspect of this presented words in order to read out the colors, right? So this is a measure of inhibition. So, and it was found that among participants who attended the mindfulness meditation, right, program, they were able to complete this task more accurately, right, and also also a lot quicker than those who went through the control treatment program. Okay, so that wraps up the part on how mindfulness can enhance our brain functions. Next, let me move on into the brain. So how does mindfulness change the brain? So let me Okay, so going back to the mindfulness study that we did at Mind Science Center a couple years ago. So in this same study, we collected MRI scans both at baseline and also subsequently at various points throughout the study, right? So, right, before this 9-month intervention program, right, we carry out a baseline scan, and after the 9-month intervention, we carry out an MRI scan, and then we simply compared across time in between groups. So what we found after 9 months was that the brains in the mindfulness group were not significantly thicker than those in the control group. So yes, there was some relatively minor increase in the thickness of the frontal regions, but on the whole, I think the results were not very significant, right? So these results were slightly disappointing. Mindfulness meditation did not lead to significantly increased thickness in the brain. Okay, but then if you recall, right, the way we ran this intervention is that in the first 3 months, the interventions were the sessions were carried out more regularly, right? We had weekly sessions, and subsequently in the next 6 months, right, the sessions, they only carry out once per month, right? It was like less intense, less regular. Okay, so if we were to look at the brain changes across sorry, I think I talked about this. Yeah. So yeah, if we were to look at the brain changes across the first 3 months, right, you would see that there was significantly increased cortical thickness somewhere in the inferior temporal gyrus. Okay, this is somewhere over here, right? So you can see from this graph over here, the MAP represents the people who went through the mindfulness intervention. The HCP represents the people in the health education group. Okay, so you can see that like at baseline at the baseline time point, right, participants in the MAP group, in the mindfulness group, right, they started out with having a thinner left inferior temporal gyrus, right? But subsequently, 3 months later, on average, the thickness in this region actually has become significantly thicker compared to the health education from the counterparts in the health education program. So they've essentially overtaken the health education program, right? Okay. But subsequently, in the next 6 months, where we run the intervention once per month, you see that this cortical thickness, right, it simply dropped back to normal, to the baseline level. Okay. So what this means is that mindfulness meditation is most beneficial to the brain only if it is practiced frequently and regularly, right? At least once per week. Okay. If you do so, most likely you'll see increased thickness in the inferior temporal gyrus, which is somewhere over here. Okay. Right. So in this region here, the inferior temporal gyrus is a region that's known to be involved in attention control and perhaps some memory processing as well. Okay. So on the whole, if you look at what I've talked about in my previous slides in relation to mental functions and over here the MRI related findings, you see that, right, there's a huge focus on attention over here, right? Mindfulness meditation seems to work on our attention systems in our brain, right? It improves our attention ability. It improves increased thickness in regions that are associated with attention in the brain. Okay, so again, right, there's a major limitation. So this is just one study, only 54 participants, right? Some of you might not buy this story, might not be convinced by this finding, right? So what if we pull together all previous MRI results from all previously published mindfulness studies, right? So instead of one study, we look at multiple studies that have been previously published. Okay, so let me share with you the findings of another meta-analysis that was carried out by my PhD student, Savannah Siu from NTU, right? So NTU Psychology. So what my PhD student did was that she pulled together 11 mindfulness intervention studies that included MRI scans, right, both at the baseline and after the intervention, right? So we put together 11 mindfulness, the MRI scans from 11 different studies, right? So these 11 different studies totally include a total of 581 participants. So it was found that on the whole, right, on average, across these 11 studies, mindfulness meditation increased gray matter volume in the right insular and precentral gyrus, which is somewhere over here. So this region here is known to be, again, involved in attention control and processing, and perhaps a little bit of self-referential processing. So if you're thinking about yourself, perhaps this region will light up as well. Okay, so I think with this pooled findings, right, I think we are more confident to conclude that yes, mindfulness have some significant effects on the brain. Okay. So, but wait, that is not all, right? So mindfulness do not simply mindfulness does not simply make our brains bigger or thicker, right? Mindfulness meditation also rewires our brain in several ways. So according to research that was published by researchers from the Harvard Medical School, it was found that participants who went through the mindfulness training, mindfulness meditation training, right? There are different ways in which the brain rewires itself, right? For instance, it was found that there was a disconnection between the salience network, that's colored in purple here, and the cuneus. So the salience network is like a switch box in our brain. It triggers when we are alert. It triggers when we are aroused. So the cuneus is a region in our brain that deals with visual processing. Okay, so this disconnection is not a bad thing. In fact, it was found that this connection actually was resulted in improved self-awareness, right? So we are more aware of ourselves. We are more aware of our strengths and weaknesses. Okay. So these group of Harvard Medical School researchers also found increased connectivity between the default mode network, which is colored in blue over here, and the frontal parietal network colored in green over here. So the default mode network is involved in many different functions, such as self-referential processing and social cognition. So for instance, if I'm thinking about what you are thinking, if I'm trying to read your mind, this part will become active, right? Okay, or if my mind is drifting away, this part will become active, right? And this frontal parietal network, this is the seat of our higher order intellectual abilities, right? So if you want to plan, if you want to strategize, right, this region will be active, right? So overall, they found that there's an increased connectivity between these two sets of network, right? And this increased connectivity roughly correspond to improved attention control. So another key set of findings that was reviewed by these Harvard researchers was that there are certain connectivity changes, certain wiring changes somewhere deeper in the subcortical areas, and the cortical areas somewhere here. So there is increased connectivity between the dorsal medial prefrontal cortex and the rostral anterior cingulate cortex. There's also a disconnection between the rostral anterior cingulate cortex and amygdala. Okay, so the amygdala deals with the amygdala is a region that activates when we experience negative emotions, when we see something unpleasant, when we feel something unpleasant, or when we feel threatened. So this disconnects. Okay, so what this means, according to researchers, is that this wiring changes over here, it actually improves our emotional regulation. All right, so I've reached the conclusions, finally gone to the conclusions of my talk. So in conclusion, you see that, right, there are actually very strong findings, right, not just in Singapore, but worldwide across multiple studies suggesting that regular mindfulness meditation sessions, it helps to sharpen our mind. More specifically, I think it works on our attention system, right? So we will be able to, control our attention, redirect our attention more efficiently and effectively. We will be able to exert a better self-control, right? We'll have better working memory, and we'll be able to multitask. So these improvements in mental functions, right, they can be explained by changes that occur in the brain, right? For instance, certain regions in the brain becomes thicker, becomes bigger, right? Certain regions in the brain becomes more, certain regions and certain networks in the brain becomes more connected, right? More connected to each other, or sometimes in certain instances they become disconnected, right? So these mindfulness related improvement changes, right? They do occur even among senior citizens who are at risk for developing dementia, right? They do occur even among people who have already experienced some kind of brain degeneration, right? So I think this is another very important finding. So another key finding from another key takeaway from my talk is that the consistency in the practice of mindfulness, this is paramount to the benefits that you will see after you meditate, right? So just as in a physical health domain, you need to exercise regularly. Similarly, in a mental health, in a brain health domain, you need to practice mindfulness regularly, right? At least once per week, or if you have the time, do it daily, right? Just simply 15 minutes a day, right? So the more frequent you practice your mind, the more frequent you practice mindfulness, the greater the benefits you observe on your mind, right, and on your brain. So overall, right, to wrap up, right, everything that I've talked about, right, in the past 20 minutes or so, right, so there is strong evidence to suggest that mindfulness meditation, it can be seen as a neuroplastic intervention strategy to keep our mind and our brain healthy, right? Neuroplastic intervention meaning that it changes our brain, it changes our behavior, right? It changes our intellectual, it changes our mental abilities, improves our mental abilities, and these changes roughly correlates with the changes we observe in the brain, right? And all of these changes, all of this benefit, we can do this without the use of any drugs, any medicine, any side effects, okay? Which is wonderful, okay? Yeah, so with that, I've come to the end of my talk. I've like to acknowledge funding from research donations from the Kwan Yin Tong, Cho Temple, and Lee Kim Ta Holdings for the mindfulness awareness practice study that was carried out a couple of years ago. So I also like to acknowledge the contributions of the late Mr. Wee Sinto for developing and structuring the mindfulness intervention, and also Dr. Goligan for developing and delivering the health education talks. And in relation to the mindfulness meta-analysis on the MRI findings, I'd like to acknowledge the funding that was provided to me by the Nanyang Assistant Professorship grant. All right, thank you very much. So yeah, I will take your questions.
Okay, great. Thank you, Prof. Yu. I think that was an excellent overview of the present state of affairs. And there are lots of questions here. I think some of it came on quite early, and you actually answered it as you went along and presented your talk. I think one of the questions was who was the control group and was anything done for them? And I think quite clearly you went on to explain they received health education. So we can put that one aside. There was also a question about whether it would work with more senior people, whether age was a factor. And I think you also addressed that by saying, yes, even with senior people, I think senior citizens' mindfulness practice will help. So age really is not a limiting factor. So maybe we'll look at some of the other questions that came on. And let me just get this right. Okay, so I thought the first one was quite interesting. It asked about when people are engaged in religious practices like praying and meditation, can these also be considered mindfulness activities?
Well, I believe like mindfulness is like a significant part of the Buddhist philosophy, but whether it will benefit your mind, brain, really depends on how regular you do this, how intense the sessions are. All right, and so I think some of these monks, they can engage in this practice for a very long period of time in a very intense manner, right? And that is certainly it will definitely benefit your mind and brain, right? So it depends on how how intense this practice is, right? Yeah, it has to be intense enough for it to be treated as an exercise.
Yeah, I agree with you there. And I think someone also, Mr. Mock said, should mindfulness practice also include meditation or just practice daily life with more consciousness? I think a certain element of meditation is important to bring your attention and awareness into focus, but I can defer to you, Prof. Yu. So the question is, mindfulness practice, must it include meditation?
Well, I think meditation is a very general term and mindfulness is a very general term. There are certain meditation procedures that are certain meditation certain school of thought in meditation that does not involve mindfulness. Although most, I would say that, from my knowledge, most meditation schools of thought of meditation, they have a significant mindfulness component.
Yeah.
Okay. And of course, whether it benefits you or not, it depends again on the intensity and how regular you perform this mindfulness session.
Okay, thanks. And I think there was a question on the duration of mindfulness practice for the subjects in that study. Was it 1 hour or 2 hours or more? So definitely not. We only spent, there was a break for the older people. In the mindfulness study, we only did it for about 15-20 minutes and we had a break.
I think it's 45 minutes. 45 minutes.
45 minutes, but with a break in between because they needed a comfort break and things like that. So total 45 minutes with a 5 to 10 minute break in between. Yeah, that's what happened. All right. Then there was, the age question. Okay, there was a question really that asked about whether there was any investigations on the effects of mindfulness on the brain in terms of language abilities, especially in dementia patients, and whether it would help improve communication with others.
So I think mindfulness is something that works on your attention systems in the brain. I think the most significant effects of mindfulness will be observed in your attention abilities. Language, not so much. Although I believe mindfulness will help you socially, because it gives you better self-awareness, right? So because of this increased self-awareness, it might improve interactions between people, right? But not so much. I don't think there'll be a specific observable improvement on language abilities. Even if there is, it might just be a small one. It will not be as significant as the improvements in attention.
Okay, thanks. So there's a question from an anonymous attendee about why the study included multitasking as a measure of improvement due to mindfulness. So the comment was mindfulness is to be in the moment without the stress of multitasking. So why did we include that in the study? Yeah.
Because if you think about it, mindfulness, it involves quite a bit of multitasking as well. You have to focus in your present moment. You have to monitor your thoughts to make sure you're not drifting away. If you're drifting away, you have to redirect your attention back. It's quite a lot of things going on in your mind. So there's a little bit of multitasking. Not a little bit, a lot of multitasking when you are trying to do a mindfulness meditation as well, right? Yeah.
Okay, great. So here's a question. Will mindfulness still help a dementia patient after the patient has been diagnosed with dementia, or only with those before the onset of dementia?
I think it might be a bit more difficult for them to be able to achieve the optimal mindfulness state, right? Because as I said, this is not an easy task. This requires effortful control of your mental thoughts and mental processes. So for people who are currently diagnosed with dementia, they might experience some difficulty in these processes, in exerting self-control. But that doesn't mean it is certainly does not mean that it is impossible. Just a matter of training, perseverance. If they're persistent enough, then perhaps it might work for them.
Yeah. Okay, great, thanks. There is this. Okay. All right. There's another question about how to carry out the mindfulness and things like that. Maybe later on the AWE program, the people involved in it can answer that question. All right. Here's a question about, are there also studies on the type of brain waves with mindfulness practice?
Type of brain waves?
Yeah, so that means I suppose probably EEG studies.
Of course, I think in terms of brain waves, right, the higher frequency waves, like for instance, gamma waves will represent greater activity in the brain. So when participants, they meditate, you see like, high more probably gamma or delta activity, suggesting greater activity during the mindfulness session, right? And perhaps after the meditation session, you'll see that they are more at ease, right? They are more rejuvenated. You'll see that these waves, they will be slower in frequency, will be quite close to like a beta or alpha waves. Yeah.
Okay. Here's a question on what is the evidence for mindfulness impacting the brain stem?
So I believe the brain stem is like involved in like some vital bodily functions such as sleep, breathing, heart rate, and so on. I don't think that the mindfulness interventions, or the different specific, the mindfulness components of the intervention, they specifically target the brainstem, because I think the brainstem is not involved in any of the attentional processes. So I don't think we will see like any significant changes in the brainstem.
Yeah. So here's a question I can answer, I think. It says, what is the exclusion criteria for your study? Example, level of literacy, education level. I think we can say that we didn't exclude anyone, right? So the only thing we included people of either males and females. Our criteria was an age criteria, those above 60 who had MCI, but we didn't exclude that on the basis of their level of literacy or education. Yeah. Okay, that one I can do. There have been quite a lot of questions about where they can learn mindfulness practice and things like that. Maybe we can leave that to the end. I'm not sure whether somebody from the Age Well program can sort of give a brief overview of the training programs that are available and how people can actually do anything, can learn and acquire those skills. Okay, what other things have I not answered? Okay, yeah. Okay, we'll come back to this again, I think, because this question was raised. Building on what was said and asked, I suppose, what is the difference between meditation and mindfulness? Since this question keeps coming up, maybe do you want to sort of run through that again?
So mindfulness is just a general idea about attending to the present moment. Right? It does not necessarily involve the actual meditation procedure. Right? Mindfulness meditation is the meditation procedure that is like rooted in the mindfulness practice. Right? For instance, we can describe someone as being very mindful. Right? That means he's always like very self-conscious, attending to the present moment. It can be a personality trait. Right, you can have someone who is very mindful, right, who often like attends to the present moment and so on. Okay, so mindfulness meditation is the activity, is the task that you perform, right? And obviously, I think according to some research, it suggests that if you perform this mindfulness meditation regularly enough, then you'll become a more mindful person.
Yeah.
Right.
Okay. Great. Okay. There's this question. Okay, really, it's talking about hearing impairment. Does it impact practicing mindfulness and improving cognition? I think it's a whole big issue, right? Hearing impairment can, if you can't, because you usually start training with a master or someone who teaches you. So if you don't have your hearing aid and you have severe hearing impairment, it can be difficult actually to, follow the instructions that is helping you to focus your awareness, your attention, and so on. So in that sense, yes, it would impact how well you can practice mindfulness. And of course, that then moves on to whether you see any benefits in terms of cognitive improvement. Okay. Here's a question that is also interesting. Heard there are e-note pads with preloaded games claimed to be helpful for dementia persons. Okay, so this is slightly moving out of our talk area. May I have your view on this? So I think this is an area you're familiar with, Prof. About using these computer games, basically, right? Preloaded cognitive games, and whether they are helpful for dementia patients.
So I guess ultimately, if you want it to benefit your brain, want it to benefit your mental functions, it has to be intense enough and it has to be regular enough, right? But the trick with dementia patients is that some of these games, they can be quite a struggle for this dementia from people who are diagnosed with dementia. They try it for the first time, they don't like it, and they just don't feel like continuing it. So for dementia patients, you have to be able to do some kind of exercise that is like easy enough for them, that is easy enough and engaging for them. That's something that they will want to continue doing on a regular basis, right? Perhaps some of these games, they might be like that, right? Perhaps some other games might be a bit too difficult. So it really depends on the nature of the games.
Okay, thank you. Yeah, so Mind Science Center team, Cindy, Maureen, does anyone want to talk about training or the programs that we have for mindfulness practice? Do you have anything that you'd like to share with those who are hearing it?
Yeah, I guess I can, because there's a lot of questions into it.
Yeah.
So I guess I'll just share
Yes.
a bit about what we have. So we have a program called Age Well Every Day, which is based on whatever Prof Rathi's and also Dr. Yu's research has done. All these findings has turned into a community program called Age Well Every Day. So that is run by our partners mostly in CCs. But what we have done, especially during COVID, is actually we have created an online learning e-portal, because we realized that we can train more people that way. So if you just give me some time to open that portal and let you guys see, so we work together with the SUSS UniLearn team and stroke support session. So if you go to this link, awe.unilearn.edu.sg, I think one of my colleagues, Cindy, has also sent the link to the group, to the chat. There we have a few modules that are relevant for the elderly. If you are interested in mindfulness, then it's in this lifestyle management too. So it's about stress management, the skills and strategies, and also some tips and tricks about how you can start mindfulness. And if you want to join the mindfulness session, actually, we have some AWE partners, and they are running some sessions, so you can join their sessions. It's the end of the year, so I think their sessions have ended for this year. But next year we will have more sessions. So if you guys are interested, right after this, I will send you a link to join our mailing list, and you will be the first to know whenever they are starting a new session, so you guys can join that. One thing that we are also doing is that we have a free mindfulness session actually every Friday afternoon during lunch. It's online through Zoom. It is it's free, and you can just join us if you just want to learn and see for yourself how a mindfulness session can go. So that's a few things that we are offering, and you guys can try it out also.
Okay, I think that Friday session sounds really interesting for someone who hasn't been involved in this and wants to experience the process. Yeah. Can I also ask, is that the end, Maureen? Because there's another question I thought maybe Prof. you can address.
We still have 5 minutes, so I think we can.
Oh yeah, okay. So sorry, Prof. There was another question. Someone asked about whether mindfulness could help in traumatic TBI, traumatic brain injury. I think that's a kind of challenging question because it depends on what sort of injury, but nonetheless, maybe you could address that question.
So I think in the context of TBI, the nature of the impairment, the nature of the disability can be quite diverse or different across different people, right? For those who have like impaired attentional abilities, it might be more difficult for them to carry out this type of mindfulness task. But again, it is not impossible. So you might have to start from like smaller steps. Take smaller steps, do like 5 minute sessions, and then slowly increase the timing, 5 minutes, 10 minutes, 30 minutes, and so on. Right, so it might be a challenge for people who have this kind of attentional impairments, but for other people who have impairments in other areas, perhaps it won't be as difficult, because the key thing to note is that mindfulness is basically kind of like an attention exercise. So whether it is easy or not depends essentially on your attention abilities.
Okay, so I think we have come to the end of our session. Thank you, Prof. Yu. It was really interesting. I'm so glad you summarized it for us and simplified it for us. Thank you very much. Yeah. So I'll hand it over to Maureen and Cindy. Yeah.
Okay.
A big thank you to Dr. Yu and Dr. Rathi Mahendran for facilitating the webinar today. Do follow us on Facebook and sign up for our mailing list to be in the loop when it's ready. Before we close, please help us fill up the post-event survey by scanning the QR code or clicking the link sent by my colleague in the chat. On a side note, we have 2 ongoing studies that are recruiting participants. If you are interested to be part of the research, contact the research team for more information. The contact details will also be in the ending slides after this and also in the chat now. If you would like to try our mindfulness sessions, we have this free online mindfulness session every Friday, 1 p.m. You can sign up by scanning the QR code shown on the screen. With that, we have come to the end of the 4th Living with Dementia webinar series. Once again, I would like to express our greatest gratitude to everyone for joining us today. We certainly hope that this session has renewed a passion in all our hearts to prioritize our mental well-being. Thank you and have a nice day.